optimal healing rate with significantly fewer side effects. In seed implantation, the radiation source is directly inserted into the prostate. Learn how the effective and gentle procedure for treating prostate cancer works in this video. My name is Dr. Stephan Neubauer. I am a specialist in urology and urological surgery here at the West German Prostate Center in the clinic at the Ring in Cologne. The goal of any treatment for patients with cancer is to achieve the best possible healing rate while avoiding unnecessary side effects. Nevertheless, many men with prostate cancer are still subjected to radical removal of the prostate and have to accept severe side effects such as incontinence and impotence for the rest of their lives. For those affected by early detected prostate cancer, there are always gentler treatment options available in addition to surgery, which achieve at least the same or even better healing rates. This includes above all the so-called seed implantation, a special form of brachytherapy. Instead of removing the entire prostate in a burdensome operation for the patient, the prostate is targeted and irradiated from the inside. In seed implantation, small radioactive sources known as seeds are inserted into the prostate under ultrasound control and remain there. They release a low dose of radiation directly to the cancerous tissue over several months. That's why it is also referred to as a so-called permanent low-dose rate brachytherapy, LDR. Through the precise placement of the seeds, the entire gland can be covered with the desired radiation dose. The exact distribution of this dose is precisely calculated in advance using a special planning system. This has the advantage that prostate cancer is treated precisely without damaging the surrounding healthy tissue, such as the bladder, intestine, or sphincter. The minimally invasive procedure can be performed under general or local anesthesia. Patients can usually leave the clinic at the Ring the next day. About 4 weeks after the procedure, a so-called follow-up plan is made. Here, computed tomography is used to check that the seeds are still in their originally planned positions. To monitor the further course, quarterly follow-up examinations with PSA controls are then carried out. The major advantage compared to surgery is healing rates that are at least equivalent to or better than surgery, significantly reduced side effects, particularly no incontinence, and much less frequent and severe impotence. The patient is not taken out of his private environment or professional life. He does not have to undergo any rehabilitation measures. Long-term studies show that seed implantation not only has partially better healing rates, but also significantly fewer side effects and long-term consequences, resulting in an extreme advantage in quality of life. Due to the highly precise radiation of the prostate, involuntary urine loss, known as urinary incontinence, occurs only very rarely, even years after the treatment, unlike with the surgical removal of the prostate. According to studies, impairments of sexual function and erectile ability are observed significantly less frequently, at 10 to 30% compared to after surgery. And they do not occur immediately as with the surgical removal of the prostate, but if at all, they appear significantly delayed. In contrast, numerous studies, most recently the large so-called PROTECT study on over patients, have shown that patients suffer the most from the consequences of treatment after radical surgery. Thus, after 6 years, 17% of operated patients will still rely on pads, while 67% had an erection sufficient for sexual intercourse before the study began. After 6 years, it was only 12%. Similarly clear is the result of a study by the Barmer Ersatzkasse. According to it, 70% of the operated patients complained about erectile problems, 53% about sexual disinterest, and around 16% about urinary incontinence. At the West German Prostate Center, we can confirm the long-term effectiveness of seed implantation and its advantages through lower side effects based on our own patient data. Since the year 2000, we have performed more than 9,000 brachytherapies, including almost 2,000 permanent seed implantations in patients with low-risk prostate cancer, and have followed up for over 20 years to see what has become of the patients. If you would like to learn more about seed implantation in general, brachytherapy, or prostate cancer, Simply schedule an appointment with us here at the West German Prostate Center in the clinic at the Ring in Cologne. We look forward to seeing you.